A very good afternoon to all. I'm going to be present a case on the title, Clearing the Myopic Maze Navigating ICL Complications. High myopia poses challenges in refractive surgeries due to extreme refractive errors. Implantable columnar lens ICL is a novel option for managing high myopia, offering significant advantages over traditional refractive procedures like LASIK, PRK, etc. A 29-year-old female came with complaints of high myopia. Her uncorrected visual acuity was found to be 6 by 60 in both eyes. Best corrected visual acuity came down to 6 by 12 with a refractive error of minus 17 diopter spherical in both eyes. Initially, ICL implantation was performed in the right eye under topical anesthesia. Patient was counseled and topical eye drops were started. On postoperative day 1, patient complained of severely reduced visual acuity in the right eye, limited to finger counting at a distance of 2 meters. Initial symptoms include blurred vision and discomfort. What to do now? So we did a slit lamp examination and optical coherence tomography OCT for evaluation post-surgery. The right eye ICL was found to be mistakenly misplaced upside down or flipped due to an error in orientation during the surgical placement. OCT macula identified the upside down orientation of the ICL in the right eye, confirming the surgical error. The treatment plan included detailed planning for the correction procedure, emphasizing the need for precision and careful handling. The secondary surgery included the meticulous removal of the upside down ICL. Correct reimplantation of the same ICL with proper orientation was achieved. This is a video of the second surgery that we did. Why is it not playing? So side puts were made at 12 and 6 o'clock. We did entry at 9 o'clock with the help of a keratome. The upside down ICL was then placed, lifted and placed above the iris. The ICL was removed by the help of IL holding forceps. The ICL was washed and cleaned before injecting. It was then carefully inserted into the injector. It was carefully injected into the anterior chamber from the main wound. Loops were then embedded in the sulcus. Remnant viscoelastic substance were removed. Main wound was closed by suture. And before closing the case, side ports were hydrated. Post-recovery results included significant improvement in the visual acuity, achieving up to a vision of 6 by 9 in right eye without the need for corrective lenses. Patient reported substantial satisfaction with visual acuity and resolution of initial symptoms. Key learnings from this case includes patient's counseling is very important before and after the procedure. Before loading an ICL, key points to remember would be verifying the lens power, size, proper sterility, careful handling of the lens, confirming correct orientation of lens using appropriate loading device and technique to safely place it in the delivery system. Role of advanced diagnostic tools like OCT in identifying and resolving surgical errors promptly. Thank you.
Yeah. So, how do you, suppose you're sitting, you're doing the surgery, how do
Yes,
you
ma'am.
identify whether you're putting it right or not?
Ma'am, like before injecting, the surgeon should.
No. Suppose you've just forgotten. Then on
Um,
table, how do you identify?
Ma'am,
I
we
mean,
can see
that
the
is the most
vault.
important
The
thing.
vault remains downside.
No, how would you ascertain that the vault is downstairs? Vault is convex. So they have two
Is there
boxes.
something
They
in the
have
lens?
They have the
their
yes.
holes are there. Like,
So which is the hole you have to see?
the central
So
hole.
trailing, there are two
Trailing the four.
haptics, right? The
Haan.
leading haptic and the trailing haptic. So
Yes,
how do
ma'am.
you identify? So that is the main thing out of your presentation.
You haven't done
So
this.
you read
No,
it,
I haven't, and I
you
have
read about
assisted.
it.
Yes, ma'am.
One thing I would want to ask you, you were telling about ICL, but was it ICL or it was some other lens?
Implantable phakicolamar lens.
That was IPCL. No? So you
IPCL,
had,
yeah.
because the
Okay, sir.
the appearance of the lens was not of ICL, it was of IPCL.
IPCL, yes, sir.
Yeah. So it's better to mention phakic IOL rather than telling ICL, because ICL is again a brand name, right?
Okay, sir. Yes, sir.
And this was not even ICL. So it's better to use phakic IOL in such presentations.
Okay, sir. Thank you, sir.
Sir, we'll close the session.
Yeah. I think all of you presented very well. Presentation was nice, and at your stage, presentation and making slides and your analysis, all those matter a lot, because that gives the impression that you know how to do a study and you know how to present and you know what all things to say. So, whenever you are presenting about any product, you should always write that you don't have any financial interest. And apart from that, you should always try to, whenever you are presenting, try to think that something new has come up or not, or try to figure out something new from it, so that you can always present your case that yes, I found out something new which is not there in existing literature, and this will add information to the existing literature. So that gives more a better impression about the presentation. And of course, the way you present and the analysis and all those things. And as I said, that it was not ICL, it was IPCL. You were presenting ICL, so it's better to use a generic kind of phakic IOL kind of a there were other presenters also who were using the trade name. Rather, if you have to anyhow use the trade name, then it's a different thing, but otherwise you can always use the overall, like phakic IOL and things like that, and try to get something new from your presentation. That will have a real impact. Anything new. Try to, in your analysis only, try to get something new in that. Even if you get a negative result, you can always say that we analyzed this, we tried to correlate this, but there was no definite correlation. So that will, give a good impression.
Please attend the finals of any free paper. If you attend finals of any free paper, you can know why these papers landed in final, and what was the reason, what is the quality of presentation. Includes the slides, includes everything. Okay, you guys talked very well. Every one of you presented beautifully, as sir said. There is no doubt about it. But the content, there was a lot to desire. Actually speaking, possibly not a single presentation had content which can be even given 50% of the marks. But that is where, if you see a person who has reached the finals of a free paper, any free paper, you understand. You will understand why they have reached, what all they have done, which you need to follow. Once you do that, your presentation will automatically improve.